Today's topic is cystic fibrosis. We're here with Dr. Elliot Dazenbrook from the Cleveland Clinic Pulmonary Medicine, and he's going to tell us first, what is cystic fibrosis?
So cystic fibrosis is a genetic disease that's characterized by the buildup of thick, sticky mucus in the pancreas and the lungs and other organ systems. In the lungs specifically, when the mucus builds up and it blocks the airways, and this sets up a perfect environment for infection. And these repeated infections over time are what lead to the irreversible lung changes that we see in our patients and causes them to have their symptoms such as cough and shortness of breath. Most cases of cystic fibrosis are diagnosed at the time of newborn screening. So since 2003 in the state of Ohio, every newborn is screened for the presence of cystic fibrosis. However, I see adults, usually 1 or 2 a month, that come to me that were born before newborn screening, and I'm actually diagnosing them with adult onset cystic fibrosis.
How common is cystic fibrosis?
So there's approximately 30,000 people in the United States who have cystic fibrosis and about 100,000 people in the world.
How many per year in the U.S., new diagnoses?
So there's about 1,000 children every year that are diagnosed with cystic fibrosis, and then another handful of adults.
Now, things have changed since I was in medical school. I know that when I was in medical school, this was a disease of children. Now you see a lot of adults.
CF was traditionally thought of as a disease of children, primarily because the life expectancy was so short. However, with new treatments and the multidisciplinary aggressive care of these patients, we now have patients living into their 40s.
And speaking of new treatments, I read recently that there are a couple of genetically based treatments that are more effective than past treatments. What are those?
Yeah, absolutely. The FDA just approved 2 new medications, ivacaftor and then ivacaftor in combination with lumacaftor for the treatment of cystic fibrosis. And these have been breakthrough medications. In contrast to previous medications that treated the symptoms of cystic fibrosis, these really attack the basic genetic defect to get at the root cause of what's causing cystic fibrosis. And the impact for our patients has been great. We're seeing our patients not only live longer, but they're healthier as well.
So this is one of the rare new breakthroughs in medicine where we actually have a genetic therapy for a genetic disease, and it works and improves outcomes, which is fabulous.
Absolutely, and so seeing our patients are in the hospital less. They're able to spend more time with their family, at school, at work, and overall feeling better.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.